Dr. Aragru, I wanted to know, I do drink sociably. What does alcohol do?
Alcohol, to a certain extent, is allowed. What is not allowed is carbonated drinks still. So beer would not be okay. But red wine is actually okay. The key thing is moderation.
I have two more questions. I had surgery. I had a new hip, and I had female surgery. I did get a blood clot in my lower left extremity, and I also have a hiatal hernia. So I was wondering, with those two things happening to me, would I still be a candidate?
Yeah, absolutely. Again, the best time to discuss individual person's situation is going to be at the consultation, but being on blood thinning medication, having had previous surgery, does not prevent you from being a candidate for weight loss surgery. Yeah.
Adjustable band, for example, what's the recovery time for that after surgery?
The question is, what is the recovery time for the adjustable gastric band? It's about 1 to 2 weeks. For gastric bypass, it's 4 weeks.
Yeah, this is for those two. After you lost your weight, did you have to have any cosmetic surgery? Like when you had 5 children, I mean, did you exercise all that back up?
I did have the abdominoplasty.
And the excess skin, the issue can be looked at from a medical point of view and from a cosmetic point of view. Medically, it can be a problem if there is a lot of infection, a lot of irritation. Cosmetic point of view, that's variable. A little bit of excess skin can be very bothersome to somebody. A lot of excess skin may not bother another person. But that's something that one would look at probably about 1.5 to 2 years after surgery.
I have a simple question. When you eat less, logically you should be constipated all the time. You know, that means we are carrying a lot of gases in your stomach and you are constipated. That in itself is a big problem.
Constipation is actually fairly common, especially early after weight loss surgery, and there are a number of reasons for that. One of them is the fact that you're not drinking enough liquids as before. The other reason is because some of the medication you might be taking also can cause constipation. So we recognize that, and if that's a problem, we can order different types of medications that will help, either stool softeners or even laxatives sometimes.
On the lap band surgery, you said complications are low. Well, can you be more specific? Like out of the last year, how many complications have you experienced?
As I said, with any surgery, complications are possible. For weight loss surgery, we can divide them into complications that are mild or moderate, complications that we can take care of relatively safely, and then complications that could be very severe or potentially life-threatening. So let's look at the adjustable band, for instance. The more common complications are something like slippage, for instance. That generally happens anywhere between 5 to 10%. Erosion is another complication that one can see, and that's when the band actually eats into the stomach wall. That's actually very rare in the literature and also in our practice. As I mentioned, we've seen it once in over 1,500 patients. Other complications have something to do with adjustment of the person to having the band itself. Expand your pouch, especially after the band, and that can cause pouch dilatation, which is another complication that we see occasionally. One of the questions that often comes to us from other doctors about weight loss surgery when we talk to them is, well, have you looked long term? What happens to people 20 years down the line after they've had gastric bypass? It has been looked at, and what we find out is that 20 years down the line, people who may not have been alive without the surgery are still alive. But we do not have any evidence as yet that the surgery itself in the long term created new illnesses if we follow all the instructions, like taking the proteins, taking the vitamins, and so forth.
That was about 3 or 4 years ago, was it, Doc?
About, yeah.
Years ago, I think. And everybody on the team is excellent. And so we could go out and put on some.
sleep apnea, high blood pressure, high cholesterol, would they consider me for surgery?
Yeah, as I said earlier on, even if the weight is not 100 pounds over the ideal body weight, or if the body mass index is not actually 40, in some circumstances where there are additional medical problems like diabetes, sleep apnea, or high blood pressure, if the body mass index is between 35 to 40, that could be acceptable by the guidelines we have nowadays. But obviously, when you come for the consultation, we will look at it precisely and be able to tell you. If you don't have any more questions, I'm going to stop here. I want to thank you, everyone, for coming tonight and listening to this, and good luck to you all.